Jersey marks a grim milestone as it tries to slow the spread of the coronavirus. Governor Murphy addressed the growing number of COVID cases and deaths during an event yesterday. Take a listen.
Today is not a good day. 4,686 positives, the first triple-digit day of fatalities that we're confirming since June 3rd, 104 losses of life, 3,735 folks in our hospitals. The positivity rate stayed.
This is the third day that hospitalizations for the coronavirus across New Jersey have gone up. The fear is there will be another spike after Christmas. Dr. Shereef Elnahal, former New Jersey Health Commissioner, current president of CEO of University Hospital in Newark, back with us again this morning to discuss Jersey's current numbers. Thank you again for making the time with us, Doctor. Welcome back.
Thank you for having me.
So you just heard the governor there, Doctor. Is there any breakdown detailing what population you're seeing may make most of these new COVID cases?
Well, we've been seeing some trends that we actually didn't see in the spring. So first of all, the number one demographic we're seeing of new admitted patients with COVID-19 are Hispanic Americans. And for that and many other reasons, we chose Maritza Benitez, who was the first person in the entire state of New Jersey, right here at University Hospital, to get a COVID-19 vaccine. She describes herself as a Latina American proud nurse. And she's a nurse hero and was the first person to get it. And her message delivered in both English and Spanish was extremely helpful, not only to encourage folks to take the vaccine when it's available to them, but to be careful as we approach Christmas and the rest of the holiday season.
All right, let's talk about the 104 deaths that the state has reported on Tuesday. Were these patients young? Were they old? Did they have other risk factors? Help us to understand who this is affecting.
Well, we're starting to see some more vulnerable populations be exposed to the disease, and that's always a risk even when you have younger populations spreading it amongst each other, younger, healthier, you always increase the risk that anybody might expose their elderly loved one or somebody who may be more vulnerable. And I think we're starting to see that as cases rise, especially post-Thanksgiving. And so this hospitalization peak is not unexpected, since Thanksgiving was just over 2 weeks ago. And we're now seeing the effects of that.
But let me ask you this, because you're talking about that post-Thanksgiving. We're going into the Christmas season right now. For the folks who have been admitted, have you been asking them where they think they're contracting it? Is it out in the general public, or are these individual gatherings in people's homes that is where they're contracting it? And we need to know this information, especially as we go into the Christmas holiday and people want to see their loved ones.
Well, from what we know and what the Department of Health has reported, a lot of the contact tracing is linked to household gatherings. And again, post-Thanksgiving, that makes sense. But even before Thanksgiving, when you have certain populations that live in multi-generational households, these are folks that are more exposed. But one thing to caveat that with is that only 30% or so of people are even responding to contact tracers. And so the reality is there's a black box in that data, because we don't know where a lot of these cases are coming from.
That's going to be problematic, because I think as we head into, to Dan's point, to the Christmas holiday and New Year's as well, people are trying to get a grasp on how great of an increase in cases due to the Thanksgiving holiday, but it almost seems like you can't really get a handle on that number.
It's hard because, again, you really rely on people cooperating with contact tracers. But the more people who download the app, the more electronic information we may get. There's a statewide app, and I think most states have this now, where folks will be notified electronically if they have a Bluetooth interaction with somebody who was positive. But really, there aren't that many other ways to understand how exactly cases are being transmitted.
Doctor, last time you and I spoke, you talked to me about how you had received the Moderna vaccine. Moderna, Pfizer, both in play. The first thing you said this morning was that Hispanic population, you're seeing an increase in COVID cases. Black and brown communities, we know, were disproportionately affected by this. With the vaccine out, there is skepticism. How are you addressing that skepticism specifically in communities of color?
It's a really important question. The first thing we're doing is we're approaching the community with humility and understanding, because frankly, the skepticism not only comes from legitimate questions about the science and why it took so little time to complete, side effects, et cetera, but also the terrible history of discrimination by the medical establishment on people of color, the Tuskegee trials, experimental surgeries on enslaved women. And so recognizing and legitimizing those feelings and saying, yes, there's a lot of reasons why we are not trustworthy trustworthy as the medical establishment, but here's how we're going to change that, and here's why this vaccine is different. That's how we're approaching these discussions.
Since you took part in the Moderna vaccine, give us an update. How are you feeling? Any side effects? Talking to some colleagues who have had it as well, what are you hearing?
So I had side effects, especially after my second shot. This was all the way back in October because I was in the clinical trial well before the Moderna vaccine was available to healthcare workers at large. But one thing to understand is that I don't know yet whether I got the placebo or the vaccine, and the placebo effect can cause side effects. So I will be finding out in the coming days, and if I got the placebo, I will be getting the vaccine.
And to be very clear, for those who do get the vaccine, right, they still have to follow the protocols of mask up, 6 feet, all the necessary things to help stop the spread.
Absolutely. Vaccines are not perfect, even though these vaccines have a very high effectiveness rate and a favorable side effect profile overall. You can still contract COVID-19, even though it may not make you sick, and you can still potentially transmit it. We don't know yet, even if you've gotten the vaccine. So until we get that 70 to 80% of the population vaccinated, which really reduces the chance of spread, even if somebody does contract it, we really can't know for sure whether we're out of the woods, which is why masking, social distancing, and very importantly, avoiding those household gatherings later this week in the winter holiday.
Or how long the vaccine even lasts for. We had the FDA, CDC, Surgeon General on. There's still no clue on how long this lasts for. Dr. Elnahal, your voice is so appreciated. Thank you for being here this morning. You are always welcome back here.
Thank you so much.
Have a
Happy
great
holidays
holiday.
to you.